Hi, I'm dietitian Neha Suryawanshi. I'm senior clinical dietitian and online diet consultant. So today's live session is about how to prevent GDM, how we can prevent gestational diabetes by following proper diet and exercise. GDM is very common symptom, very common complication during pregnancy. So usually it is defined as altered blood sugar which develops during pregnancy and it corrects itself after delivery. Prevention of GDM is very important to avoid future maternal and fetal adverse outcomes. Maternal risk may include abortion, cesarean section, and hemorrhage, postpartum hemorrhage, infection, and prolonged labor as well. Fetal complications include that may be a hypoglycemia condition for the fetus, which is called as neonatal hypoglycemia, infant respiratory distress syndrome. It may be intrauterine death also sometimes, some other birth injuries as well. So, high risk patients are those who had GDM in their previous pregnancy or women who have PCOD, PCOS, who are overweight, obese, and people with very strong family history and elderly pregnant women. These are commonly seen as a high risk patient. And in planned pregnancy, few steps can be taken to avoid GDM, which the most important thing is correcting your BMI. If you are in your ideal BMI, you can avoid these symptoms and you can always correct your body mass index by following proper diet and exercise. So GDM develops usually in the second and third trimester of the pregnancy, and diet and exercise are required to avoid GDM. High risk patients can go for an antenatal exercise and they should do 30 minutes of walk every day. So diet should be controlled at the very beginning. You should always include high fiber foods in your meals and always have low carbs, low fat diet. You don't need to cut down carbs too much as per the requirement, because definitely your requirements are high during this time, because there is a fetal growth and development phase during this period. So definitely you require some more calories as per the normal conditions, but again you should cut down your calories and include more fiber and more protein foods. So it should be very nutritious food which you can take during this period. Sugar should be controlled at the very beginning. You need to avoid white sugar and rice completely during this high risk condition. And I am sharing you one sample Indian diet plan for gestational diabetes here. Early morning, you can take your kesar, elaichi, and almond dalchini mix milk along with 2 walnuts. Soaked almonds also you can have 6 soaked almonds sometimes. And if you are feeling morning sickness, you can have 2 wheat rusk or you can take samolina rusk. You can have your breakfast after 2 hours around 9 a.m. You can include thali peet, besan chila, moong dal chila, palak paratha along with the curd. If you are a North Indian, you can have your vegetable oats upma and always have one big bowl of curd also along with your breakfast. After breakfast, you can have your mid-morning meal around 11 o'clock. After 2 hours, you can have your pomegranate or apple and coconut water. So coconut water is very important to have during thrice time, first, second, and third trimester, because most of the women face urine infection problems during pregnancy. So coconut water always prevent and cure these infections. So that should be included, that must be included, you can say. मिड मॉर्निंग के बाद आप लंच ले सकते हैं 2 घंटे के बाद. लंच में यू कैन ऑलवेज इंक्लूड योर 1 बाउल ऑफ quinoa pulao, or you can have brown rice. You can take your dal and curry along with it, or you can have some paneer vegetables, paneer curry. If you are non-vegetarian, you can include your chicken curry or fish curry. And 2 bajra jowar chapati or multigrain chapati can be taken. That is better than having wheat chapati. आफ्टर लंच यू कैन गो फॉर 10 मिनट्स वॉक. इवनिंग में भी आप 1 ग्लास बटर मिल्क इंक्लूड कर सकते हो या रागी की कांजी इंक्लूड कर सकते हो. 1 कप टी आप ले सकते हो वीट मैथी खापरा के साथ. 6 PM जब आपको अगर भूख लग रही है, इफ़ यू आर फीलिंग हंग्री, you can take 1 tablespoon of muesli with the milk. You can take 1 tablespoon of muesli with milk and डिनर में आप अराउंड 7 PM यू कैन हैव वेरी लाइट डिनर। अगर आपको बहुत लाइट डिनर करना है तो आप इसमें वेजिटेबल ओट्स उपमा, वेजिटेबल दलिया या वेजिटेबल खिचड़ी इंक्लूड कर सकते हो। अदरवाइज आप नॉर्मल डिनर भी ले सकते हो। 2 चपाती, जो मल्टीग्रेन चपाती या ज्वार की चपाती हो सकती है, साथ में आप गाजर, बॉटल गार्ड, तुरई, पम्पकिन, ये वेजिटेबल्स आप इंक्लूड कर सकते हो। डिनर के बाद आप बेड टाइम पे वापस मिल्क ले सकते हो, 1 ग्लास मिल्क अलॉन्ग विद दी आलमंड्स एंड वॉलनट्स, सो दैट विल हेल्प यू अलॉट। सो इस तरह का मील पैटर्न आप फॉलो कर सकते हो। हर मील के बाद आपको 10 मिनट्स का वॉक करना बहुत नेसेसरी है। अगर आप ऐसा करते हैं तो खाने के बाद आप जो ब्लड शुगर राइज होती है, दैट इज पीपी शुगर, उसको आप आसानी से कंट्रोल कर पाओगे और ब्लड शुगर को भी आप इजीली स्टेबलाइज कर लोगे। सो इम्पॉर्टेंट टिप्स फॉर यू टू मेंटेन to manage with the GDMs are always have small and frequent meals, and that it will definitely lead to healthy weight gain and control your blood sugar level as well. Always prefer high fiber and high protein rich foods, so that maybe nuts, salads, curds and other things. So take one cereal at a time in your meals. Either go for a bhakri or roti or rice if you are in a high risk condition. You can include your daily exercise. I mean, there should be a daily exercise schedule along with the proper diet, because sweating is very important for the during the pregnancy phase. अगर आपको sweating हो रहा है तो आप blood sugar को easily control भी कर पाओगे, और साथ में that also helps in the fetal development also. So exercise and diet ही है इसका एक बेटर ऑप्शन, जिसके थ्रू आप अच्छे से अपने GDM को कंट्रोल कर सकते हो, फॉलो कर सकते हो ये प्रॉपर टिप्स, और इसके थ्रू आप इसको प्रिवेंट कर सकते हो। साथ में आपको जो चीज़ें, कुछ पॉइंट्स नोट करने चाहिए, वो है कि आपको कॉम्प्लेक्स कार्ब्स लेना है। सिंपल जो कार्ब्स हैं उनको आपको कम्प्लीटली अवॉइड करना है। यू कैन इंक्लूड सम सप्लीमेंट्स ऑल्सो, डाइटरी सप्लीमेंट्स, जैसे कि आप ओमेगा 3 फैटी एसिड्स इंक्लूड कर सकते हो इन द फॉर्म ऑफ फिश ऑयल। यू कैन हैव मायोनोसिटॉल एंड प्रोबायोटिक्स, so that also prevent gestational diabetes. I hope you will find this video informative. Thank you. Thanks a lot.